Hello, greetings from AIIMS Guwahati. I am Dr. Morchana Khaun Sharma, Assistant Professor, Department of Pediatrics, AIIMS Guwahati. Today we are going to talk about hand, foot and mouth disease, a disease which is showing an increasing trend these days, especially in children less than 5 years of age. Hand, foot and mouth disease is a viral infection which is characterized by appearance of red spots or rashes or fluid-filled blisters and vesicles around the mouth, in the oral cavity, in the hands and in the feet. It is a viral infection which is mostly caused by enterovirus and Coxsackie virus. Regarding the transmission of the virus is transmitted from one infected child to another child. The routes of transmission can be fecal-oral, that is from the stool of the infected child, from the oral cavity, from the saliva, and from the respiratory tract as droplet infection. The child is mostly infectious in the first week of infection, but the child can continue shedding the virus for 4 to 8 weeks. From the entry of the virus inside the body to the first appearance of symptoms usually take 3 to 7 days. The disease can spread from one infected child to another child by coughing or sneezing, or when the infected child hugs or kisses another child, or when the infected child coughs and sneezes and without washing the hand touches another child, or touches their toys or their food which is later shared by another child. The disease can spread from one infected child to another child.
Now, regarding the signs and symptoms of the disease is characterized by low-grade fever, pain in the throat, sore throat, malaise, that is not feeling well, body ache. Then there will be appearance of rashes, that is it can be red spots, rashes or fluid-filled blisters or vesicles around the mouth, inside the oral cavity, in the hands, in the palms, in the elbow, in the feet, in the legs, in the knee joint, around the knees, in the thighs, in the buttocks and in the soles. The ulcers in the mouth are painful, because of which the child might have difficulty in eating. The good thing is the disease is self-remitting and it usually resolves in 7 to 10 days. The diagnosis of the disease is made clinically by looking at the signs and symptoms. Sometimes some samples from the throat can be taken, from stool samples can be taken, or vesicular fluid samples can be obtained to test for the presence of the virus by PCR. And sometimes to differentiate it from other infections like chickenpox or herpes simplex virus, some biopsies or scrapings from the vesicles might be required. Now, regarding the management, as the disease is self-remitting and viral infection, the mainstay of treatment is supportive. We advise the child to take rest, not to scratch the lesions because it can cause secondary infection, and the child should maintain its hydration. Since the oral ulcers are painful, the child might have difficulty in feeding, and because of it the child might give up feeding at all. So we must encourage the parents to give them some cold liquid fluid in frequent intervals so that the child maintains his or her hydration. Since the oral ulcers are painful, the child might have difficulty in taking hot and spicy food, so which we must advise the parents to give them cold or food that is at room temperature, like liquid food like coconut water, dal water, rice water, milkshakes in frequent intervals, small amounts in frequent intervals, sip by sip, so that the child maintains its hydration. Then next, to bring down the fever and pain, we can give some NSAIDs like paracetamol. Sometimes if the oral ulcers are very painful, some drugs are given to, or sprays are given to apply in the mouth for pain relief. When should the parents worry? If the child is having very high fever, persistently. If the oral ulcers are very painful and the child is not taking anything orally, and because of this the child is having decreased urine output, the child is very irritable or having altered sensorium or unconscious, then the parents should hurry up and bring the child immediately to the nearest hospital. The child might require intravenous fluid and clinical examinations to look for complications. The prognosis of the disease is very good and the disease is self-remitting, and maximum most of the children becomes well in 10 to 14 days. Some of the rare complications with this the child might develop are persistent oral ulcers, which is painful and because of which the child might give up feeding completely. Some CNS complications like encephalitis, inflammation of the brain or inflammation of the membrane surrounding the brain like meningitis, acute flaccid paralysis. Other complications like inflammation of the walls of the heart like myocarditis or pancreatitis, pulmonary or lung infections like interstitial pneumonia, and onychomedisis, that is separation of the proximal nail plate from the nail matrix. How can the disease be prevented? The disease can be prevented by proper hand hygiene. The child should be advised to wash their hands properly before eating or before taking their hands into their mouth, and when a child becomes infected they should remain indoor in their house and they should be refrained from going to school or any daycare facility till they become completely well, which usually takes 7 to 10 days. That's all for today. Thank you.